Great to be chatting here on Flow FM with the member for Schubert, also the Shadow Minister for Health, Ashton Hearn. How are you, Ashton?
I'm really well, Ricky, and good morning to all your listeners.
Thank you very much. We've had a long debate in the Barossa Valley about the future of a hospital. You've said on social media over the last 24 hours that you don't want the government to rewrite history on what's happened with the hospital. What is the history?
Well, the history is that the only party that's been fully committed to delivering the Barossa Hospital has been the Liberal Party. We made a very firm commitment from 2018 to 2022, and we made significant progress. For the very first time, there was money in the budget. We had clinical planners in the field looking at what services would be in the hospital, and we'd also earmarked some sites down from 16 to 2. Now, when the Labor Party are elected, they're trying to reinvent the wheel. They're pushing the purchase of the land into the slow lane. That's something that I'm certainly not going to buy, and nor will my community here in the Barossa.
Now, when you say the sites have been narrowed from 16 to 2, is the government now talking about a whole lot of other sites, and could it be possible that it becomes maybe a Northern Adelaide hospital rather than a Barossa hospital?
No, that's not the current suggestion, and certainly we wouldn't allow that to happen. I think the Barossa very much needs its own dedicated hospital. But what they're now saying is that the purchase of the land should only be possible after the finalisation of a detailed business case. Now, there is absolutely no logic behind that whatsoever, and we absolutely need to be securing that land. The former government had 2 parcels of land, and we were ready to purchase them in the middle of this year, certainly by the end of this year. And now the government's putting them in the slow lane, saying, no, hang on here, we only need to purchase them in March. So we don't think that's good enough. And in the local paper this week, I've called on the government to release a full timeline on the delivery of the hospital, because one thing's for certain, country people are very lynx-eared politicians who like to reinvent the wheel and promise lots and deliver nothing. So we'll be holding this government to account.
Now, when you talk about a business case, wasn't there previously a business case developed by the Liberal government? Are we looking at a second business case, or how many of them do we need?
So this is really the finalisation of the plans. This is about having the clinical service planners in the field looking at what services will be housed in the hospital. So the former government made a commitment to build a hospital. That was unequivocal. And for the very first time, there was money in the budget. So that's what's happening at the moment. That is the finalisation of the business plan. There's been a lot of work that has been looked at previously, but nothing that has been really complete. So as you would be aware, Ricky, it was 2001 when the Barossa Hospital was actually first promised, and that was the Liberal government. We then lost government less than a year later, and we had 16 years of Labor who, frankly, did nothing to progress this hospital. They had review after review after review, and it's just time to get on with them.
Now, infrastructure is one important element, but the staffing of it's important as well, and it's been a challenge across all our broadcast areas in regional SA, attracting and retaining GPs. What does the opposition say needs to happen to make sure we've got GPs in regional communities?
Well, you've hit the nail on the head, Ricky. It's tough to get into a local GP at the moment. You're waiting sometimes between 6 and 8 weeks here in the regions, and attracting and retaining our GPs are one of the most significant challenges that we're facing. So the former government had a pretty substantial increase to regional GP funding. So it was about a 20% increase, and we're yet to see all of that flow through, with lots of contract negotiations still ongoing. We believe that there needs to be a broader workforce plan. We also are calling on the federal government to review what we call the modified Monash model. That's all about how you incentivise people to come to the regions. But when you look at the whole pie and the whole challenge of attracting people to the regions, it's really complex, because not only are you looking at things like work-life balance, but there's also the serious housing shortages and just a sense of isolation that people can feel in the region. So workforce is one element, how we can train people through the system, but it really is a whole of system problem that we need to all work together to address.
And we have seen in hospital services a decline in birthing services or opportunities in the regions. There had been something being negotiated, we understood at the news desk, about an insurance crunch with doctors that the state government needed to negotiate so that those services would continue. Do we need to do more to make sure that people can have their baby closer to where they live?
Absolutely. I mean, to be able to have your baby close to your family, I think, is absolutely fundamental. You can do it in the city, and therefore you should be able to do it in the country. There's issues right across the regions, and alarmingly overnight we've seen that birthing services at Gawler have just been suspended because they too are struggling with staff. So this is something that we're calling on the Labor government to have a very close look at. It is not good enough to be winding back the services that we're seeing in the regions. And as we've seen over history and over many, many years, once the service leaves a country area, it is very difficult to get it back.
Just lastly, heading down to the southeast, the state government in opposition, they made big promises about Limestone Coast health, and I thought it was $100 million they said they were putting on the table. Have we seen any progress from the government in relation to that?
Not a single skerrick, Ricky. And you only need to look back at recent history to see which party actually delivers more for the regions when it comes to health, and that's the Liberal Party. I did a very quick comparison, and we were outspending the Labor Party on regional health by 5-1, which is pretty astounding. So I know that the government likes to talk a big game when it comes to delivering for our regional health services, but when it comes to actually getting the services on the ground or getting the shovels in the ground when it comes to expansions or building new hospitals, we haven't seen anything in particular. But Penny Pratt, who I'm working very close with as the Shadow Minister for Regional Health Services, she's keeping a very close eye on all of those commitments there, and we'll hold them to account.
Yeah, thanks for mentioning Penny Pratt. She did mention we should chat with you, and we're doing that, and we will be speaking with her again soon as well. Ashton, thank you very much for joining us today on Flow.
My pleasure, Ricky. Thanks for your time.